Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us today. Our guest is a nationally recognized and licensed doctor, educator, and natural products consultant. She's made many appearances on Dr. Oz's show and others, and now she's here today with us here on Health Professional Radio to talk about one of her books, Creating and Maintaining Balance, A Woman's Guide to Safe, Natural Hormone Health. Good afternoon, Dr. Holly Lucille, affectionately known as Dr. Holly.
Oh, yeah. Neil, thank you so much.
So, you're an author and you're also one of the leading, nationally recognized leading authorities in the field of naturopathic medicine. Talk about how you got into this and why it's important that a lot of us get on board and start listening to what's being said.
Yeah, well, I do have a philosophy that we are all in this together. I've got some esteemed colleagues that are out there fighting the good fight. But I think when I look around, what's really important to understand about other systems of medicine besides Neil Arc, conventional Western reductionistic based medicine school of thought, which I do believe has a place. Everything has a place.
Mm-hmm.
There's value in all systems of medicine. But when you look around at the fact that our chronic health issues continue to be on the rise, the projections for things like diabetes and chronic pain and obesity and cancer and heart disease, by, 2050, you can't even imagine. And I just have to scratch my head and wonder why. You watch TV at all, you've got direct-to-consumer commercials coming in every day about the new drug that's out, right? But I don't think that approach actually is doing us much good. And I think that when we look at things in a more comprehensive way, so identifying and treating the cause and treating the whole person and really respecting the first do no harm principle in that there are so many things that we can do before drugs and surgery that, our lifestyles, our diet, profound evidence-based medicine and those things. And I believe that people can get well and stay well in a much thorough fashion. And so it was because my parents were both pharmacists, and so I was like, they were always, here, take this, here, take this.
So you grew up with prescriptions.
Yeah. So I always knew that there was something different. And like I said, I think there's value in all systems of medicine. I think there's great practitioners across the board in many different schools of thought. But for our chronic, sort of modern day influenced things like fatigue and hormone imbalances and such, I believe we just need to step back, scratch our heads and take a deeper look and really think things through.
Now, you're practicing currently in Los Angeles, am I correct?
That's correct.
One of the most diverse of populations. Are you finding that your ideas more readily accepted? Maybe there's some friction between you and some of the conventional practitioners.
Sure. It's such an interesting question. I've got it before, but I tell you, because I've had the opportunity to lecture across the United States in many different markets, let's say, I guess I use that word, markets, areas.
Yeah, absolutely. Market is fine.
But I have to tell you, it is the middle part of these secondary, I think, markets that people would say, not the DCs, the New Yorks, it is the middle part of our nation that actually I think has time, and they come and they're educated and they have great questions and they get it. And so it's not necessarily that way. I think a lot of times in a city like mine, people come to me by default because whatever else they're doing isn't working, but they're going too fast and really, at the grind way too hard to really be paying attention. It's the middle people. It's the people in the middle that are getting it. They really are. That's my experience.
Now, Dr. Holly, you are an author in addition to being an educator and a lecturer. Your book, Creating and Maintaining Balance, A Woman's Guide to Safe, Natural Hormone Health. We hear a lot about hormone therapy, the pros, the cons, do, don't. Talk about hormone health for women specifically, and then for all of us as it relates to natural hormone health.
Yeah, it was interesting. This book was written, I think, in 2004. It was published, and if I go back and read it, even though, of course, people, we grow, and I have other things to say, and it probably should be updated, it still makes a lot of sense because one of the reasons that I wrote it was that I noticed that people were using hormone replacement therapy all the time. It was reaching celebrity status, quite honestly. And I thought, well, in normal menopause, there's nothing to replace. We should think about restoring function first. We should think about the influences on our endocrine system in our modern day and why women in this natural and normal hormonal transition are having such a hard time. And so it really was about that. It was encouraging people to first look at our environment, look at the way we've been nourishing ourselves, definitely look at our stressors, because the built-in backup system for pre- and postmenopausal hormone production is our adrenal glands. And those are also our big stress glands, just to be, kind of simple here in my description.
Absolutely.
Obviously, yeah. So, that's what I wanted to do. I wanted to talk about restoring function first. Mm-hmm. I do think, like I said, hormone therapies actually are a very viable method, and certainly can be used. But I think you need the devil's in the details when it comes to our hormone system. Mm-hmm. And I really think that you need a really big system approach, and people and the practitioners can't just be giving hormones at super physiological doses, because Deepak Chopra says it best. You touch one strand and the whole web trembles. Yeah. There is such a interconnected system there that is one of the most, I think, complicated. The devil is in the details, and you just have to have a big picture mentality.
Now, as a lecturer, and you're talking to lots and lots of people about, you're an expert in the field of integrative medicine. We're talking about the combining of... There
is traditional naturopathy, and then we have gone on to use... to have more credentialed schools as far as being trained in the biomedical sciences, and literally having a license to practice primary care medicine. So naturopathic medicine, naturopathic medical doctors would be the title there.
Okay. You've been doing this for quite some time. You're an expert in the field. You see the lights go on in people's eyes when you're talking to them. What is it, in your experience, the one idea, the one point that you get across that kind of drives your point home, and you see that aha moment, and they say, okay, she's got a point? What's the one thing that you normally throw out there?
Well, it's a great question, because that experience is very valuable to me, because it does happen. It's kind of like me asking somebody, how many people think eggs are dairy? And, without thinking there, I just don't want you to think these are really well-educated folks that I'm talking to, and half the room, their arms go up, and we all know that eggs, if you think about it, are not dairy. But we think that because of messaging we got from a long time ago. I'm not going to go into that, but when people go, why did I think eggs are dairy? That's exactly the aha that I want. It's like, and corn's not a vegetable, right? Corn's a grain. That I want that aha. I want that education. I want to facilitate understanding. There's a lot of information out there, Neil, now more than ever, about being well, about health. There's talking heads, there's but we still aren't doing that great. And so I want to put the dots really close together, have people connect them, own their own health, and really be in charge of facilitating understanding so they get it. And I really think that when I take the moments to make the connections for my patients and their lifestyle and their life and what they're doing in the story that I just heard, and I have good clinical acumen, they start to get it, and they start to understand that they need to be part of the process. It's not just a here, take this, fix. And that's when we start really getting ready to rock and roll.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard, and we've been in studio with Dr. Holly Lucille, also known as Dr. Holly, nationally recognized and licensed naturopathic doctor, educator, natural products consultant, and the author of Creating and Maintaining Balance, A Woman's Guide to Safe, Natural Hormone Health. And we've been here talking about her book and some of the ways that natural hormone therapy, among other natural remedies, sometimes far outweigh, but often are better when they're integrated with some of our traditional methods. It's been great having you here with us this afternoon, Dr. Holly.
Thank you.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.